Good evening and welcome to our COVID-19 update program. I'm Neota Ebe. Here are the highlights at this hour. Nigeria Labour Congress asked the government at all levels to increase the funding in the health sector as it celebrates the Global Day of Action on Care. Oyo, Enugu and Abia State Police arrest more suspected palliative looters. Ogun and Kogi government decry looting of warehouses. German Chancellor Angela Merkel warns of a long, hard winter ahead as she defends reinstatement of a national lockdown. As Nigeria joins the rest of the world to mark the year 2020 Global Day of Action on Care, Nigeria Labour Congress NLC is asking the federal and state governments to increase funding for the health sector. The NLC's president, Mr. Yibo Waba, who addressed journalists at the Labour House in Abuja, says the Nigeria government needs to take advantage of the current realities of the COVID-19 pandemic to see the urgent need to make further investment in the health sector. He also appealed to the federal government to urgently address the impasse between the health workers' unions and the government and pay the 2-month salaries it owed health workers arising from the 2018 industrial action.
Action on care is coming at the most auspicious time as the world undergoes a very challenging period occasioned by the sudden outbreak of the deadly coronavirus across the world, otherwise known as COVID-19. COVID-19 has fully exposed several countries, including our country, as having invested not enough in the healthcare institutions and even making it difficult to attain the universal health coverage, which is the priority of countries around the world. The pandemic has put everyone at risk, both the rich and the poor. And therefore, that's why the team investing in healthcare now, or investing in care now, is to draw more support and also demand for heavy investment in healthcare by our government and big businesses if we must keep a healthy society and productive human resource base. Apart from the open fact that our healthcare sector has been neglected for too long, healthcare workers have been subjected to unfair treatment. Let me use this auspicious occasion to once again call on the federal government to pay the 2-month salaries all health workers arising from the industrial dispute in 2018, please. In conclusion, we reiterate our position that government must be ready to invest heavily in healthcare sector as no country survives without effective healthcare and a healthy people.
Now, the Enugu State Police Command has arrested 23 young men suspected to have killed police officers and vandalized public and private properties in the state. According to the Commissioner of Police, Ahmed Abdul Rahman, 97% of the suspects are from the neighboring Ebonyi state, whose sole intention was to cause mayhem in Enugu. He reiterated the commitment of the police to protect lives and property of the people.
People have to learn not to allow whatever demonstration they are doing to be hijacked by hoodlums and these miscreants, because that's a danger. Demonstration does not mean that you go into people's shop and begin to loot. Protests at the same time does not mean that you break into people's factory and begin to loot and vandalize and set ablaze. Protest does not at the same time mean that you should go to police station, bring out policemen, kill them in cold blood, and set them ablaze. Set the station ablaze and collect their rifles. What is the purpose? Is that part of protest? The answer is that there is an ulterior motive behind it. You will see beyond the mask. You will try to figure out what the man behind the mask is trying to do. He has a completely different agenda.
'Agenda. Meanwhile, the Kogi state government says the damage inflicted on the state central medical store by some suspected hoodlums under the NSAS protest will be difficult to replace. The state's Commissioner for Health, Dr. Saka Audu, disclosed this at a press conference in Lokoja, the state capital, after he led a team from the ministry and the media on an inspection of the burgled facilities along the Zone 8 area. He said the state is currently quantifying the extent of the damage and will eventually make public the list of the stolen items and their cost implications.
No, let's go.
Health officials in Kogi State on a tour of a central medical store complex, or what's left of it. Built under the Essential Drugs Program of the state government, it's from here that drugs and hospital equipment are distributed to health centers and general hospitals across the 21 local government areas. Sadly, the facility is not spared in the looting and vandalism carried out in the aftermath of the NSAS protests. Test kits, drugs, and other pharmaceutical consumables are missing, while machines for magnetic resonance imaging, computer tomography, digital mammography, digital radiography, refrigerators for vaccines, solar power units, laboratory equipment are vandalized. The damage is beyond anything the state government had imagined, the losses running into billions of naira. It's too much to bear for the Commissioner for Health, Dr. Saka Audu, who breaks down in tears while briefing the media on the situation after the inspection.
It is indeed a very unfortunate development that the state will find very difficult to recover from, as we don't have the capacity to provide what have been carted away or vandalized in a short time.
Indeed, it's an emotional briefing for the state health authorities. Even the executive director of the State Primary Healthcare Development Agency, Dr. Abubakar Yakubu, is equally moved to tears as he tries to explain how everything was lost in just 2 hours.
This is the right time for us to come together, to stay together, and to defeat this menace of our society.
The Kogi state government says it will take a miracle for its health sector to recover from the losses, a miracle it prays will manifest soon.
And just like it happened in Enugu State, this time in Abia, 18 persons who were suspected to have been part of the looting and damage caused during the protests have been arrested. The Commissioner of Police, Janet Agbede, who briefed journalists in Umuahia, the state capital, on their actions, said that one of the rifles taken from the hoodlums has been recovered, while efforts are on to recover the remaining two. Said the command is committed to a crime-free state and debunked rumors of an intending attack on the state by herdsmen.
On October 24, 2020, the hoodlums break open a warehouse opposite Golden Guinea in Umuahia, where scanty bags of fertilizers and a few bags of rice for replanting, preserved with chemical, were kept and started stealing them. However, following a distress call, a combined team of the police and the military timely arrived and repelled them. As at now, a total number of 18 persons were arrested, with one FNC rifle with 12 rounds of live ammunition and other weapons of violence in connection with the killings, looting, and burnings. I wish to reassure the law-abiding citizens and residents in the state to go about their lawful businesses, as the law enforcement agencies are ever ready to protect their lives and properties.
And while some states were impacted by the looting of warehouses where palliatives for COVID-19 were stored. And then there are rumors of impending attacks on some other states where palliatives are also stored. The Ogun State government says all warehouses in the state have been emptied of the palliatives, which have since been distributed to the vulnerable across the 20 local government areas. The Commissioner for Special Duties, Femi Ogumbanwo, and his local government and chieftaincy affairs counterpart, Afolabi Afuakba, says the palliatives were distributed to those who deserve them, while assuring those who probably are left out of the last batch of the distribution. The commissioner has maintained that about 21,000 residents are being targeted by the state government in partnership with the private sector on interest-free loans to the vulnerable to cushion the effect of the pandemic.
Beyond these food items now, there are other plans from the government, which I have been telling people, even in the course of distributing these items. Like we are still planning now to give 10,000 cash to about 21,000 vulnerable women in the state, courtesy of Dangote Foundation. So I would just advise them that they should just exercise patience. Anybody that miss out of this one, I can assure, in the next round. And the state too has its own plan for the people. There are a lot of welfare plans. So I would just advise our people to exercise patience.
All the 20 local governments have been fully supplied of their needs. The other beneficiaries are not left behind. Other people like the host community, people that come, people that we think are in their need of this palliative. In Ogun State, that is the way we work. Ordinarily, without this NSAS protest, this will have gone without any hitch.
And let's talk about education at this time. The federal government is asking tertiary institutions to work out a plan that would cater to the instability in their academic calendar for fear that it might affect the quality of education as it is. The Minister of Education, Mr. Adamu, says the instability of the academic calendar is impacting negatively on the government's efforts to provide quality tertiary education. He was represented at the 15th annual retreat of the Association of Registrars of Nigeria in Abuja. He said what he described as a tension brewing in public universities over the appointment of vice-chancellors is not helping the system at all.
From across the Federation, registrars of Nigerian universities conferred in Abuja for the 15th annual retreat of the Association of Registrars of Nigerian Universities. The chairman of the association sets the tone for the retreat as he bemoans the challenges facing university education in the country.
There are a lot of challenges facing the administration of universities, particularly these days when we are facing a lot of erosion of autonomy of Nigerian universities by various agencies.
The Executive Secretary of the National Universities Commission, who represented the Minister of Education at the occasion, harps on the need to maintain a stable academic calendar.
We, as I say, are in a very deep crisis in Nigerian universities today. The system is expanding, but the complexity is not the main issue at stake. It is the instability in the system.
In a keynote address, a former chairman of the Independent National Electoral Commission and former vice-chancellor of Bayero University, Kano, prefers solutions to the challenges confronting university administration.
If the national context is undemocratic and authoritarian, it constrains or obstructs democratization of university administration. On the other hand, even if a country can be said to be under democratic rule, a streak of undemocratic and authoritarian disposition by university administrators would be unwholesome and obstructive of realization of the vision and the mission of a university.
The two-day retreat with the theme, University Administration in Nigeria under Democratic Rule, Issues, Challenges and Way Forward, is aimed at repositioning Nigerian universities ahead of the resumption of academic activities.
Still talking education, the Kano State government is threatening to cancel the 2019-2020 third-term academic session of all private schools if they fail to cut down the fees to 25% of what it used to be. A State's Commissioner for Education, Mohammed Sanusi Said Kiru, said the decision became necessary in consideration of the hard economic conditions experienced as a result of the lockdown owing to the menace of COVID-19, which affected both the socio-economic position of the general public. Further explained that 2 parallel ad hoc committees are already been set up to discuss with the owners of private schools on the percentage of school fees they are to reduce, as done in about 4 to 5 states, or cancel the third term totally so that the academic calendar will commence with a new session in January 2021. Mr. Curry asked the proprietors of private schools to show some sign of appreciation for the support they enjoyed from the state government and extend the same magnanimity to the good people of Kano State. Commissioner assured the good people of state that if by the 1st of November 2020 there is no positive response, the ministry would be left with no option than to take such a revolutionary decision in public interest. The government therefore called on all proprietors of private schools to reduce their school fees with a minimum of 25%, or the ministry will be left with no option than to cancel in totality the third term of the 2019-2020 academic school year. Let's look at a little bit of what's happening. The latest figures from the Nigeria Center for Disease Control says 147 new cases and 4 deaths have been recorded in the latest release. The 147 new cases are reported from 12 states. Lagos has the highest figure with 82 cases, the FCT 20. Rivers State reported 9. Kaduna and Plateau have 8 cases each. Benue 5, while there are 3 cases each in Edo, Kano, Nasarawa and Taraba states. Ogun State has 2, and 1 case is from Bauchi State. This brings the total number of cases to 62,231. Have been confirmed, 58,095 cases have been discharged, and 1,139 deaths have been recorded in 36 states and the Federal Capital Territory. We'll take a break. When we return, we'll look at the conditions for the reopening and plans to ensure that the second wave is completely avoided with Nigeria. Do stay with us. Thank you for staying with us. Now let's look at a little bit of immigration as regards the likely or possibility of a second wave across the world. Nigeria's immigration service says adherence to COVID-19 safety protocol is imperative in the daily operations, as officers are first and last points of contact at any entry and exit points. This is coming from the Lagos State Command. The Comptroller Aliu Bauchi explained that all migrants in the state are routinely sensitized on adherence to all safety protocols.
Nigeria Immigration Service, through the very proactive leadership provided by the CGI, Mohammed Babandede, has been in the forefront of tackling the issue of COVID-19 by respecting and putting in place all the necessary protocols. If you go to our airports, Murtala Mohammed International Airport, especially here in Lagos, and other airports and all entry frontiers, you will notice that all the protocols as provided by the NCDC are being strictly followed and adhered. And also here, we deal with public. We put all the necessary measures. We have the chlorine buckets. We have the sanitizers. We ensure that anybody that comes in contact with you, he has to be properly sanitized and also having the face mask on all the time. So I would like to tell you that Nigeria Immigration Service has been in the forefront of doing that. We know that the COVID-19 and similar other diseases of cross-border transmission. So we are mindful of this, and that is why we are taking all the necessary measures.
Well, that's coming from the controller of the Lagos command of the Nigeria Immigration Service. But meanwhile, Nigeria, like other African countries, hasn't been spared from the spread of the coronavirus pandemic. And to overcome these challenges, the countries have been advised to keep testing and treating and isolating to reduce infections. Many of these governments have started reopening their borders, but following the relaxation of measures and border restrictions, there are fears of increasing the number of infections. And despite the efforts made by the Immigration Service at this entry point, Nigeria's borders were reopened on the 5th of September 2020, months after international land borders were shut down in March to reduce the spread of the COVID-19. Now, border security officers in Nigeria are already contending with a raft of challenges and deterring illegal traffic and ensuring safety. They also have to help in curbing the importation of COVID-19. And one of the major challenges is reaching remote border communities and convincing those who believe that COVID-19 does not exist. I'm being joined by Dr. Oladapo Ashiombi, a public health physician, and he joins us via Skype. Dr. Ashiombi, thank you for joining us.
Thank you very much, and good evening, viewers.
I'm sure you heard the controller of the Lagos command talk about what the plans or what they are doing in the airports and the entry points through the airports and all of that. But then one begins to wonder, the Nigerian government, with all of this that have been put in place, do you think it's enough to stop the possible importation of more cases of COVID-19?
Well, that's the best we can do, considering the personnel and all the resources we have to man our land, air, water, borders. But I'm not sure it will be enough, considering the long border we have, the number of countries that are neighbors. I mean, if you take it from the sea in Lagos, right down towards Benin Republic, then you look at Niger, then Chad, Cameroon, and back to the sea. And Niger, Chad, more importantly, these are just continuation of the the Sahel region, where we know there's a large mass of ungoverned space because of the security challenges in the North African region, including our own border with Chad, Cameroon, where there is insurgency. So we're not likely going to be able to keep inflow and outflow of people from our land borders. Same thing with our sea border. I mean, just 2-3 days ago, about seven Nigerians were arrested off the shores of UK by the special squad, and they were still away from a ship from Nigeria. So if they can go out, then they can come in. So we're not likely going to be able to do that. And considering we're not even testing enough, we're basing our reaction and yes.
I was going to ask you about that matter of testing. Are we even testing enough? I mean, you talk about the long border lines Nigeria has with the neighboring countries, Cameroon, Chad, Niger, and Togo. But if you look at that, along that borderline, you also have some remote communities. But even beyond those remote communities, when you cross the borderline, see those communities, there are other remote communities that are having borders with the border communities. And how much of testing is going on at the borders, not to talk about what's going on in those remote communities, when in the urban areas, the testing is not even enough. So how do we manage all of this?
Well, the only thing we can do is just still rely on what the evidence we have from the little or no testing that we've done. Now, consider that all those are neighboring countries are also countries that are not testing enough. So we cannot rely on them to have done the test, because all these countries have, how will I call it? They are poorer than Nigeria. So they even have more resource challenges than Nigeria. So they're not even testing as much as we are. So we can't rely on them to test for us. Well, now that finally we have the antigen testing to then track what is happening to people who are at high risk or have been in contact. The good thing that is working for the whole of Africa is that this pandemic happened not to have had the effect that everybody thought it was going to have in Africa. Of course, there are many reasons for that. So we are living on the reality of what is happening, that the impact is not as much as it is in richer countries which have older population, and their movement is even far more interwoven than ours. Just imagine somebody trying to cross our land border. Maybe the person is a migrant from the north of Africa or a herdsman running across the Sahel. You know how long it will take for them to do that work or use a car? Compare with high-speed train and all that, and interconnectivity in Europe and America. So those things, I think our resource challenge is working for us one way or the other, even if the science and the resource is not enough to help us do the best.
Talking about resource and the challenge of resource management, there's that issue of coordinating the data that's been set in, harmonizing and coordinating data sent in by the border officials from the various border points we have and from the various security agencies. Put that on one side. Then look at the matter of research, how much of investment we've put into science and research in the country since this pandemic came and opened up the fact that we have a need in that area. Do you see any hope or any light at the end of the tunnel?
Well, if it comes to communication, that's not so much of a problem, because information and data and the results that they get, that can be sent by even 2G network, as in SMS. Even if you are in Kauram, Namuda, so far you can send SMS. Then the results and all that will be exchanged with the central collation office. So the different ported services, I'm sure they have SMS network. So if that is there, then report is not an issue. When it comes to research, well, we're not doing it badly. If you go on the WHO research network, there are two areas of the research that is happening. One is in therapeutics and the other is in vaccine. But on the therapeutics, I mean, Nigeria seems to show up on the bubble. So we're trying. I mean, when you think about the chloroquine trial we have helped to do, the ones NAFDAC is also doing, the one different scientific organization are trying to do in the area of therapeutics. So at least we're on that bubble. For vaccine, well, we're not there, because it costs a lot to do the vaccine one. The therapeutic is just about drug treatment. I mean, we already have chloroquine. We don't need to reinvent it. It's just to find out, does it work, it doesn't work. Or any of those other medication herbs, we already have them. Do they work or don't they work? So we don't have a problem. But vaccines are a new thing entirely, because you have to open new grounds of innovation and then collaborate with people. And the amount to do that is not very cheap. I mean, we're talking about things in billions of dollars. I'm not sure our national budget total will even be able to support that type of big. But if we partner with companies that are already big doing it and that have foothold in Nigeria, we might be able to join the research with the trial stages. I mean, recruit hosts, recruit people who will be the first set of stage 1, stage 2, more of stage 2 and stage 3 clinical trial to be sure of the effectiveness and side effects. So that we can easily do. For example, we know AstraZeneca is one of them, and AstraZeneca has a foothold in Nigeria. So the research arm can link up with the AstraZeneca in Nigeria, and then we join to do the research and have, at least we'll be able to have data that concerns blacks and our own population when it comes to safety and efficacy of those vaccines. And do so with all the other big manufacturers. Yeah.
Dr. Ashemi, before we let you go, let's look at this matter of belief. Now, the numbers, you talked about the fact that the numbers are not as expected when this whole thing broke out. Africa is not being affected as much as other people thought it would be. Now, Africans are also known, especially Nigerians, are also known to be trying out some things, both natural and on their own, like, for instance, chloroquine. But there's that thing about belief. So you find a lot of people, maybe 4 out of 10, using their masks, unlike what used to be when the lockdown was really in place. So you found fewer people using face masks or using sanitizers. What do we do with the fact that the number of people that believe that this thing actually exists and are taking precautions appears to be dropping by the day?
Okay. I was in an international communication conference earlier today, and something struck me, which we've always preached for the community primary care, and that is that government and knowledge do not stop pandemic. It is community and people who stop pandemic. So you can give all the knowledge you want, you can do all, but if you don't engage them, starting from their own beliefs or unbelief, in this case, let's call it unbelief, it's to get a groundswell of people. Why don't you believe? What do you think we can do? Things you want them to believe, and then not just believe but act on. You can believe something and don't act on it. You can get information and don't act on it. And that is the hallmark of wisdom and behavioral change communication. That's what we need to do. Target at community level, behavioral change communication, work with them, move from their level of belief to a higher level of belief and a change in behavior. I think that we'll continue to do until we get a vaccine or this pandemic just fizzles out.
All right, thank you very much, Dr. Oladapo Ashiombi. He's a public health physician and he joined us via Skype. Thank you for sharing your evening with us.
You're welcome. Good luck and keep safe.
Thank you. You too. All right, let's talk a little bit more about education and schools resuming. Lagos State has approved the reopening of schools for all classes in public and private schools across the state, beginning from Monday, the 2nd of November 2020. While the borders in these public schools are to resume on Sunday, the 1st of the same month. The Honorable Commissioner for Education, Mrs. Folashade Adefisayo, said that this has been an unprecedented year with the recent happenings that have regrettably led to frequent closure of schools with attendant learning disruptions faced by all children. And in her words, pray that children and hope that there will be no more disruptions in the academic calendar. However, the state government will always regard the safety of pupils, the students, parents, and all staff as a matter of priority. She stressed that the recommendation that when schools are resumed on Monday, teaching and learning should continue unhindered till the end of the term. The commissioner asked and advised pupils and students to take their studies more seriously in a bid to recover the lost period and thereby excel. Again, we're looking at that matter of the second wave of the coronavirus around the world and the question of understanding and management of the situation. We have joining us Dr. Ibrahim Bolaji, who is the president of the Medical Association of Nigerians across Great Britain, MANTAG. Thank you for joining us.
Thank you very much indeed, Channels, for inviting me.
Thank you. He's joining us from Lincolnshire in the United Kingdom. Dr. Bolaji, this matter of the second wave, the rules in England appear not to be working. That's coming from the scientists and you being one yourself. With the 96,000 a day getting the coronavirus, which has reached a critical stage, it says, in England and doubling over time. But why is this so?
Right, thank you. That's a very good question. The past weeks have seen COVID-19 induced lockdown being introduced in different areas for a number of reasons. And our lives have continued to be hugely restricted by the lockdown, and our work is now dominated by the second wave for coronavirus. You asked the question, why do we have second wave? Second wave is not unexpected. If you know what is the current statistics now, we now stand at 46,000 total deaths, approximately about 280 new deaths a day. In the UK, we have 96,000 cases in total. Recently, with 23,000 new cases, and the hospital admission has increased quite dramatically, and that is almost about 166,000. There are a number of reasons for this. Immediately after the first lockdown, all the students moved to their respective universities. And we've seen cases of undergraduates interacting, disobeying the three rules, the three mantras: hands, face, hands. But the second wave has had different interactions in the different four corners of the nation. And the formula that have been used are very different. For example, in Wales, they've introduced fire break restrictions. In Scotland, they introduced 5 levels. And the tier system is a sort of traffic light system based on prevalence. Tier 1 in England, for example, all cases that are less than 100 per 1,000 will be in tier 1. If it's more than 100 cases per 100 per 100,000, they'll be in tier 2, and extremely high level will be in tier 3. And the traffic system that have been introduced, for example, in tier 1 is the one that is very generic to all the parts of the UK. The rule of 6 obtained. What does that mean? No more than 6 people can stay both indoor and outdoor if you're in tier 1. All the venues must be COVID secure. However, the schools, universities, worship places are open. Weddings and funerals will go ahead with restrictions on number. Organized indoor sports and exercises can continue. So there are continue to be interactions in tier 1. But if you then move from tier 2 to tier 2, all the rules that I've listed to you are observed, in addition to there is no indoor interaction. Social distancing is maintained in tier 2. Rule of 6 can occur outside the room. But if we then move to tier 3, in which Liverpool and Manchester are falling into, and of course London, there's no interaction both in and out, except in parks, in public places, and group of not more than group of 6. The fear currently is that shall we go into total fire break restrictions, have they done in Wales, to ensure that the whole country is more or less go into total lockdown? The battle that the leadership have is interaction between the health of the nation and, of course, economic management. And the problem will occur around Christmas time. And there are a lot of discussions about what happens if these are not restricted by December, because everybody will break the rule, I'm sure, in the UK. And the question of restrictions will be very difficult to enforce. So the question is this the time to go into fire break restrictions? But nobody actually knows the formula. Different formulas are used in the different 4 nations, but time will tell who is right and who is wrong.
Talking about time telling, in a space of just 3 months or thereabout, finger prick tests were done amongst 365,000 randomly selected people, only to find out that the immunity to the COVID-19 appears to be waning. So COVID-19 antibodies in the systems are dropping. If that is a situation on a random test of 360,000 people, you talked about the possibility of this thing getting worse by December. It's already evidence that the immunity is dropping. Shouldn't more drastic measures be taken to reduce the interactions as much as possible, even before December?
It is a battle between 2 things, health and wealth. If you want total interaction, the wealth will win. If you want total lockdown, the health will win. So what the government is trying to do, basically, is a balancing act between the economic situation. Don't forget, the effect of lockdown itself, we've underestimated what it is. The mental issue, the committing of suicide by people that have lost their jobs. Businesses have actually closed. A large number of young individual workers have lost their job. So it's a very delicate balancing act with the government. But we also need to learn from what is happening in Europe currently, in France, in Germany, total lockdown has occurred. And we seem to be following Europe, and there's a delay gap, which is about 2 weeks. And my expectation and my prediction is that there will be total lockdown in about 2 weeks' time. It's a matter of time. If the prediction is similar to what has happened before, because we seem to be lagging behind Europe by 1 to 2 weeks.
Dr. Balaji, in all of these things that are happening around the world and Europe in particular, what lessons can Nigeria learn from this situation?
Yeah, the lesson is very simple. Precaution, precaution, precaution. And the mantra that we currently use, hands, face, distance, these are the key. Extremely important to wash our hands as frequently as possible. It's very simple. Soap at least 2 minutes. Cover our faces if we cannot maintain social distancing. And where possible, ensure that we maintain that space. The problem I see with our country, obviously, is that so many rules are broken. You see a lot of people in the marketplace maintaining no social distancing and possibly not wearing face masks. I think the simple test will be, remember, wash your hand, wear face masks if you cannot maintain social distancing, and where possible, always maintain that social distancing, extremely important.
Thank you very much. Dr. Ibrahim Balaji is the president of the Medical Association of Nigerians across the Great Britain, MANTAG, and he joined us from Lincolnshire in the United Kingdom. Thank you for this evening.
Thank you for inviting me.
Now, the German Chancellor Angela Merkel has warned of a long, hard winter as the country resumes lockdowns to curb the spread of the virus. Ms. Merkel was defending the reinstatement of a national lockdown in Parliament, where she was heckled by right-wing members of Parliament as she outlined the new measures. Rising coronavirus infections and deaths are triggering tougher restrictions across Europe. Here's more on this and other developments in our COVID-19 Global Update.
With coronavirus infections rising sharply across Europe, more and more countries are imposing tighter restrictions. France on Wednesday recorded 36,437 new COVID-19 infections, 3,020 more than the number registered in the previous 24 hours. President Emmanuel Macron ordered the nation to go back into a national lockdown on Wednesday, like in mid-March, when COVID-19 patients in the first wave of the epidemic overwhelmed hospitals. On the streets of Berlin, residents are mostly supportive of the latest government measures to curb the spread of the virus. Worried hospitals will be overwhelmed. Chancellor Angela Merkel announced on Wednesday a month-long lockdown from November the 2nd to include the closure of restaurants, gyms and theaters. And over in Spain, the parliament has voted in favor of extending a nationwide state of emergency by 6 months, giving regional authorities extra powers to control a second wave of the virus. And according to a study by Imperial College, the spread of the coronavirus continues to increase across all parts of England, with cases doubling every 9 days. Despite this, the British government says it will do everything it can to avoid putting the country into a second national lockdown and believes it can control the virus with tough local measures. Housing Minister Robert Jenrick says the government wants to stick to its policy of local lockdowns, which now cover huge parts of northern England, although he adds that everything is being kept under review.
And this is how we end our COVID-19 update for tonight. You can have a look at some of the global and national figures on our website, channelstv.com, and update on all safety protocols as well. Have better understanding of what is required to stay safe. Check out our page for other stories on politics, sports, and business. Join us for a fresh package of the program tomorrow at 9 p.m. Thank you so much for watching. I'm Neo Taigwe, and have yourself a good night.